Thank you, Chair Takano, and thank you to all of our witnesses. I'm a physician, but I'm also a 24-year military veteran. And I just wanted to comment on the last comment made. I would rather have veterans have care anywhere than not have care and commit suicide. And I think one of the challenges that certainly I face in my district, and we have an excellent VA hospital at Iowa City, is that there is often a reluctance and a delay in the VA allowing people to receive care within the community. We have excellent care that's with substance use disorder, mental health, suicide prevention, and that was the intent of the Mission Act, was that veterans receive care. So I just want to state that. And then I also want to reiterate something because the public often watches these hearings, and it's an oversight hearing. But I want to just reiterate something that Ranking Member Bost had said. We did a Veterans Roundtable in our district, my district, just a couple of weeks ago, and that when we listen to these hearings and we participate in them and we talk about veterans, we're trying to conduct oversight and also make sure veterans have the benefits and the resources that they need and to which they earned, not they're entitled, they earned. But with that, often the veteran is portrayed as someone broken. And we rarely talk about the vast number of veterans, by far the greatest majority, who lead productive lives, who are assets to their employer, assets to their community, do volunteer work. So I just wanted to state once again that the vast majority of veterans don't face these issues, and part of that is because of the care you gave. So just kind of in follow-up to my first statement about community care, Dr. Campbell, in their testimony, America's Warrior Partnership notes that the scope of the Fox grants was dramatically widened to include national and state-level programs. How many of the 80 grants awarded went to statewide or national programs? And how will you assess their effectiveness at the local level within the communities these grants are intended to target?
Thank you, Representative, for that great question, and I'll defer to Dr. Miller.
You are correct in terms of the scope. However, within that context, there needed to be direct links established at the local level, and then there needed to be outcomes that will be measured and produced at that local level. If applicants were not able to make the tie from a national or state level to a local level in a way that pre-post could be reasonably measured, they were not awarded a grant this year.
Okay, thank you for that. And then my next question is perhaps best geared to the next panel, but I've got another meeting that I have to participate in. And so, you know, within our district and our state, and we've done our veterans panel, and as a veteran, I meet with my veterans group. I'm part of both my VFW and American Legion. I've been really impressed with what the American Legion has done in introducing systems like the Buddy Check program. And this is a system to connect veterans that may not know who to ask or where to go when talking about their mental health. And this is extraordinarily important. As you mentioned, the VA hospital understands the military culture. Veterans understand other veterans. And the Buddy Check system has seen to be effective, as the American Legion has seen more than, nationwide, 234,000 veterans reached through this system. In our own area, we've seen suicide rate decline. And what's the VA doing to implement a similar system or ensure that veterans are getting the direct and immediate care and the, if you will, peer support from fellow veterans?
So thank you again for that great question. My colleagues and I a couple of weeks ago met with the National VSO leaders right here in Washington, D.C. American Legion was part of that. I am not aware of the specific Buddy Check that you're talking about, and I'll certainly ask my colleagues if they know more than I do.
I think, thank you for asking this. I think we've heard today already about peer support and buddy checks, and I think there's a lot of different names for veterans taking care of veterans. And I can give you one great example. In rural communities, we have a project called Together with Veterans, in which we are working with veterans to help them identify best ways to reach out to veterans in their own communities, to identify risk, to be there for each other, to teach each other about lethal means safety. And so I think there are many names for buddy checks, and I agree with you. This is so important in terms of overall suicide prevention.
Thank you so much. I yield back my